All right. Good morning, everybody. Welcome. It
Well,
is it is May 20th. We got Cade here. We got Regan. Cade, how's it going? You ready for this?
it's going great. I did not hear the cue. I thought we were waiting for the countdown. So my bad. Welcome everybody to the Healthy Self podcast and webinar. This is your host and moderator today, Cade Archibald. Really stoked to be here with everybody and really excited to be with our main stage speaker each week. It's a very special day today. It's somebody's birthday. It is Regan Archibald's birthday, and I think that's a day to celebrate. May 20th, 1970 something, maybe 80 something. We'll say 80.
1978.
I know your year, but
Oh, okay.
yeah, you can be whatever age you want to be.
Thanks. I guess
It's your day.
I guess it's my day. So I mean, I'll just tell you guys, being 29 feels amazing. I mean, my soreness is gone immediately after I work out. I've got just robust energy.
It's all those treatments you do, right?
All the treatments just keeps me at 29, just going.
Medicine treatments just keeps you at 29.
That's it. It does feel good though. I mean, this is it's a really amazing time to be alive, and so really happy to be on the show with everybody, sharing my birthday with you. I'll give you guys a quick preview of what's my wife did for me today. So can you see that, kid?
Look at that. Well, you got to show the one wheel. Where's the one wheel? Watch out. It'll get.
I can't quite. Let's see. I can't quite get the one wheel. It's down there.
Oh.
Yeah, that thing is squirrely. Being on the one wheel. I don't know if you guys have ever done a one wheel, but yeah, it's they're fun, but they're squirrely.
Yeah, it's great for balance for sure.
Very good for balance.
You'll end up with some battle wounds.
Yeah, Cade's still recovering from his. Yes.
So we got a unique show today. Really excited about it. We're going to be diving into some different pain solutions, and then we got a guest coming on as well, and so we'll introduce him in about 20 minutes is when he'll be joining us. But before we hop into that, want to make sure everyone was able to attend the Health Accelerator course last night. I was at a dance recital. That dance recital went from, I was there from about 4:45 till about 10:45 last night. I was not prepared for that. But yeah, it was great though. The girls did great, but whew, I was not ready for that marathon. But how did the hack go last night, Regan?
It was so good. So good. We had a great group on there. We actually, the hack for the week, if you guys missed it, is exercise every day. It's not 1 day a week or 2 days a week or 3 days a week. It's every day of the week. That's the goal. That's the hack.
Love it. So, and is that like they got to get in, they got to bust out an hour workout, or what's that?
Yeah, I said I don't even care if it's 30 seconds, if you're just like, I don't have time to work out. Well, before bed, do 10 sit-ups. It can be something as simple as that. But ideally, what we're looking at is a minimum of 120 minutes of exercise per week. So you can slice that up however you want.
Nice. I like it.
Yeah, fair enough, right?
Fair enough. Yeah, if I miss a workout in the day while I'm brushing my teeth, I do air squats. That's my punishment for myself. If I miss my workout, it's air squat time.
There you go.
It develops some quads and buttocks, as you've witnessed.
I have witnessed that. Cade did get the quads and buttocks in the family. I think mine all just went to my brain, is what I'm going to say. All right. Well, we got some important things to talk about today. So I guess before we do, I'm going to preface this with there's a lot that changes and a lot that stays the same. And so what we're going to talk about today is some of the things that are going to be changing according to the new FDA guidelines. And then we're going to talk about some things, that may impact each one of you and your ability to get certain treatments. And then we're going to have a guest come on, Dr. Buzz Korth, and he's going to talk to us about some of these, kind of the amnion product, the stem cell therapy world, stem cell recruitment, because one of the things we've been doing is really maximizing people's ability to heal with certain products. And so the FDA has come in and they've said, well, we want to make sure that this is safe and effective, and so they put in criteria, and some of these new criteria do affect many of you. So we'll talk about that today. What did Irene say? Honorary on our birthday, honorary on our birthday, aren't we? Yes, we got with exercise. We're got to be honorary. I took Dom and I were doing deadlifts this morning, kid.
Nice.
Yeah, we did deadlifts, pull-ups. I can now do pull-ups with my shoulder. Thank you, Utah Cord Bank, for providing such amazing care for my shoulder. Many of you have had their products too. I put the Stem Max into the shoulder about a month ago, and now I can do pull-ups.
That's killer.
Yeah.
Last time, like what, 2 week or two ago, it was you were like struggling to even to have your arms back like this.
It still hurts to have my arms back, but I can do pull-ups. So yeah, but that's getting better. It's all improving.
Right.
Okay, so we had a big announcement, Cade. We let people know, and we're going to let you guys know. The Russel Health stem cell recruitment product is going to be unavailable after May 31st. And so for those of you who have been able to enjoy using your Medicare benefits and receiving those services, that is all changing. The manufacturer will no longer be producing that particular product. And so what that means, and many of you are probably saying, well, why? And Cade, maybe you can explain why this policy's come up, and I don't know how technical we want to get, but we can get a little more technical with Buzz on the terminology. But then I want to really shift the gears and show people what we've created, so it's actually even better than it's ever been.
Yeah. No, I think that's the exciting part. The reason why I think there's it's hard to say why, other than the FDA's role. They like to regulate the food and drug industry, obviously, and so their overall objective is safety and efficacy. I think there's been a lot of historically over the last maybe 5-6 years, there's been a lot of different things come out around regenerative medicine, stem cell treatments, things like that may not have been exactly what they were stated or marketed as. And so I think that's some of the reason why it's disheartening to an extent, because we're getting a little more clarity, but there's been a lot of ambiguity with what their guidelines are going to be. And so we're finally now getting it more streamlined. But yeah, ultimately, some of the products, some of the amnio products are they have to go a drug route, and so they have to go through investigational trials. The labs are going to have to invest millions to even billions with a B into these products to get them to the marketplace. And so I think there's definitely some trials with that. There will still be some, it sounds like we'll still have some what are classified as 361 tissue allograft products that will be available for treatment to an extent. It's just a matter of which ones and how they can be used is kind of the big question mark right now.
Yeah, and the FDA, was on their webinar last night with Peter Marks, and he's just a phenomenal doctor, really bright. He said with regenerative medicine, And these tissue products, they want this industry to thrive. They've got a big, their agenda is actually to help move it forward. But in doing so, they had to create some definitions. And one of the definitions that they've got is this term called homologous use. And that means like versus like. And when they looked at the product that, some of the Medicare, guidelines met, they realized that, man, that product does not meet our homologous use, and therefore it needs to be a drug if it's metabolically active. And the other thing that Dr. Marks recommended is, or said they're now starting to enforce, and they've talked about this for 4 years. In 2017, they really kind of put a line in the sand and said, hey, you've got to, if you are manipulating your product at all, if it's more than minimal manipulation, if you're not using it for homologous use, then it is considered a drug, and it needs to go down the proper channels of an IND. And so last night he clarified that more, and he said all labs are going to have to prove that they are a 361 product. And so I'm going to bring on a lab, Buzz Korth. Dr. Korth has a phenomenal facility. We're waiting on Utah Cord Bank right now. They were waiting on an official stance from them, and so as of May 31st, we may not be able to get any of their product either. So we're, for those of you many of you have already called the office and you've secured your units, and so congratulations. I would recommend that you guys get that done in the next few days. And if you want to do anything that's related to Medicare with the Russel Health product, the one that you've enjoyed and that's worked really well, we have to get that done by the end of the month. And if you do not have your insurance card verified, you've got to do that by the 24th of May. So we're letting everyone know there are deadlines to these things, but just get everything taken care of by May 31st. We're going to have new things that will come, and I think they're going to be new and better. New things that will come in the future. We just don't know exactly how long that will be. So Kate, should we move on? Any questions on that anyone's got before we kind of move on to our, kind of our strategy and our plan for getting you out of pain and still providing the best possible service?
Had a comment come in from Ruth. She said, I have my stem cells banked with American Stem Cell. Haven't heard anything from them. Is this like birth tissue banked? Because if it's birth tissue bank, those you can use that for what they term autologous use, which is, that's your own products, and so that's not a problem. You can still bank those. I have my last child's birth tissue, like umbilical cord, the fluid, all that still banked with Utah Cord Bank, and there's no problem with that. Ruth saying, oh, that was from your thigh. So it's adipose or fat tissue. I don't know.
The Dr. Marks was very specific on the use of adipose. And Ruth, this is one area, I don't know where you have it banked, but that's one area where the FDA has clamped down, and they said it doesn't meet homologous use if you're using it for joints, because the joint, you don't want fat in the joint, right? I mean, you're going to have some fat around it, but they said if you want to use it for, fillers, for cosmetics or breast augmentation, no problem. But they were very clear about not using adipose-derived stem cells in joints. It's a non-homologous use, which means it has to go through an IND process as a drug, even though it's your own stem cells. So yeah, they're getting pretty serious about this. And then Diane, someone asked, can I get stem cells after May 31st, or can I get any treatments? Yes, there's still treatments that we can do after, we can certainly talk about that. All right.
Great. Let's dive in, because I know a lot of people are wondering, okay, well, if this isn't a treatment option for me, how do you address my pain?
Right. And so let's talk about that. So first of all, one of the things that Kate and I did is we just said, well, if you look at the amazing capabilities that we've had in our clinic, I mean, we've been around for 17 years. And in the 17 years, we started as an acupuncture clinic. And I started working with a neurologist about 6 months after I started. So I always wanted to be East-West. I want to bring the best of both worlds. And so in this process, we've slowly added in other service centers. And these service centers have really been able to allow us to maximize our ability to help you. And so one of these service centers that we brought in was trigger point injections. We've done hyaluronic acid. We've done different treatments for longevity, for autoimmunity, for the brain. But in our whole makeup, and even doing these tissue allografts, what we've done is we've never relied just on one service to maximize your overall outcomes. And as we've identified that, we've always, and you've noticed this, we don't just do one injection, send you on your way like most clinics do. But what we've done is we've created these phases of care, the 3 phases of care. And then in those phases of care, there's different treatments that we put in each phase. And so what I'm going to share with you today are these 3 phases. And so these 3 phases are what most clinics miss. And so as we go through as we go through your program, many of you now are going to see this new program design that we're creating for all of our patients. And for those of you who actually have received a program design from me, how do you like it? I got yesterday, Kate, I had feedback. I had a patient just when she got that, Misha presented it to her with a new plan. And she said, this is so helpful because now I see that there's actually a process in place to take me through the next year of care. Just made her feel so good.
And you can actually see it all come together. I think it's beautiful.
Yeah, so we'll just say Cade, this is your treatment plan for the year, okay? And so we're gonna go from May 20th. So your 29-year-old brother is gonna be 30 next year when we review, when we get done with this plan. So we'll go 5/20, and then we'll go 21. So you got that, and so what would you say? What are the main things that you want to work on? And you can throw out some arbitrary things, or it can be hypothetical, or it could be real.
Build muscle.
Okay, so build muscle.
Wait, or lose some fat.
Okay, lose fat. Pain. Just throw out pain. I know you've done really well, but let's talk about pain, since this is kind of our focus and where we're going in our treatment plans. Back pain. Okay. All right, good. So some of the pathways, phase 1 for you, the first thing we want to do is we want to remove inflammation, right? So imagine if your house is on fire and you go in and you say, well, let's start rebuilding the house. I know the kitchen's on fire, but the living room's fine. I think we could really start putting in some new carpet. There's no reason why we can't start spackling some of the holes in the wall. What's going to happen?
Eventually that fire is going to take over, and the work that you did may not, it's not going to last.
It's not going to last. So step 1 in any type of pain is we have to remove the fire and removing the inflammation. I'll show you how we do that. That's so unique and so powerful. Phase 2, this is where now we can talk about repair. So we've got to repair the damage, right? And so this is where we start at the foundation. And a lot of clinics you go to, and in some cases, one of the capabilities we have now is we're working with pain interventionists with Integrated Wellness, our newest clinic in South Jordan. And so we can put the fire out really quick because some of you have such severe acute traumas that we may need to do a little like low dose anti-inflammatory injections. There may be some things we do to reset your nerve, like an ablation for those nerves so that we can regrow them and reset it. But, but we get rid of the inflammation really quick, and then we go in and start repairing the damage. And so a lot of people come in to repair the damage and they'll say, well, let's just fix the living room first. But Cade, where's the best place to start if you've had a structure that's been damaged?
Foundation.
I already have that in there. So that was a low ball. I gave you a freebie there. And if you don't fix the foundation, the whole thing can go, you can get skiwampus. And so we start at the foundation and build up based on the tests. And then the third phase, and this is the fun phase, this is the regenerate phase. And so a lot of you, we've worked with peptides, we've worked with nutrition, we've got your hormones balanced, we've worked on the 5 core pillars of health, and in removing inflammation from all 5 of those. I apologize. Sorry about that, guys.
Someone wish you happy birthday.
I know my phone's been blowing up. I'm turning it off. And so as we look at the 5 pillars, the gut health, detoxification, nutrition, hormones, we look at fitness and exercise and brain health. It's really important that all those are in place to remove the inflammation. You start repairing the body from the inside out. And then the regenerate stage that's how I was supposed to turn 43, but actually turned 29 today, is because of this regenerative phase.
Beautiful. Cut off 14 years.
Crazy, isn't? I mean, I just got to say, I appreciate that, that it's happened, but regenerate and remodel, it's like, well, healing never stops. And so we want to continually push this third pathway of regenerate and remodel, because you're going to put some stress on your body. We're going to take off the stress, a little bit of stress, take off the stress. So the end result, Cade, what would you like freedom from if you look at your health? Why do you want to put on more muscle and lose fat, for example? What are you looking for freedom from?
Freedom from, I just want to be able to move. So, freedom from pain and lack of mobility.
Yeah. There we go. Okay. And so then you'll have freedom too. And so you better movement, right?
Better movement, surf better, mountain bike and snowboard better.
Yeah. Okay.
We'll see you soon, Irene. She just sent a message. I think she's got an appointment. She's leaving for St. George.
Oh, nice. Good, Irene. Enjoy it. Okay. So good. Those give you freedom too. And then our overall wellness plan, what we want to do is we want to cultivate, open up the 3 pathways. Increase vitality and energy, and promote tissue integrity. So tissues means like, all of integrity, all of the structural tissues and the glands in your body. So some of the tests that we're going to need, well, first of all, images, right? And images can be x-rays. These can be MRIs. All those images, those can be really helpful. And the other thing that we're going to do is we're going to look at testing blood. We got stool. How many of you have done a stool test before? It's not the funnest test to do, but the stool test is actually so critical to your overall health. And our 3 core tests that we do, we like to do it on every single patient, is get a comprehensive functional medicine test, get your stool test and your saliva test. And we're going to do this 2 times a year. That's ideal. All right, kids. So I want all of these tests. And then the treatments, what we're going to do is peptides. We're going to do allografts, depending on what allografts we can get. This is just part of an overall plan. That will help with the stem cell recruitment and stem cell health. We're going to do acupuncture, PT, chirocare. I had Vanessa did e-stem on my shoulder, some acupuncture with e-stem yesterday. Holy smokes, is really good. She's our newest acupuncturist in Salt Lake, and it was awesome. And then the other treatments, I mean, if you think about these things, this can be even where we do the gua sha. We got trigger point injections. We've got ozone. We've got PRP. I mean, there's so many great things that we can do for you in the treatments, all right? And so, and then Cade, the teaching, your curriculum, I want you in on the hacks, the Health Accelerator challenges every Wednesday. I know you missed last night. I'm going to give it to you this time. You can have a freebie, but you can't miss again.
I
And
can
so
also watch the recording.
you can watch the recording. So those things are there, but you got hacks and then working with your health coach. So we believe in mentorship. Health can be so complicated. And so having someone distill all of the knowledge that we get from the tests, you can just break that down. So the 3 phases, remember phase 1, Cade, you remember what phase 1 is? We're removing what?
That's removing inflammation.
Yeah, we remove inflammation. So how do we do that? Well, we've got to clean up the diet. So we're going to go through and create a nutritional plan. One of those is the hack that we had the week before this one, which was no sugar. So that's a big part of removing the inflammation. We got to clean up the diet. The second thing we're going to do is we're going to get you on the right supplements based on your lab. So we're going to do lab reviews and pull out the right supplements. The equal inflammatory supplement, anti-inflammatory supplements. There's going to be some peptides that we're going to recommend for anti-inflammatory use. Ozone, Regen Med treatments. These are all going to be there to reduce the inflammation and remove it. Phase 2 is where we start repairing, right? And so this is where we really want to start working on the foundational, your structure, your posture. I notice you slump a lot, Kate. I think your beard's getting so heavy, it's starting to pull your head down. You're getting tech neck. So we're gonna shave that thing off, and that will help. I think if we cut off your chest hair, that will help a little bit too. So we're gonna get the posture, really start working, at PT with the chiros, and then start working with the accus on getting all that connective tissue in place. There's going to be peptides that we use in the reparative stage. These can be like your BPC 157. We're going to get you on thymosin beta 4. Those are going to be some critical ones. And then we jump into the final phase, which is to regenerate. And this is the fun phase because this is where we really start maximizing like growth hormone so that your body can heal much quicker. It's good for your connective tissue, not good for the brain.
Not necessarily using growth hormone, but really activating it.
I'll put growth hormone peptides. Because kid, you're not a candidate for growth hormone. Sorry, there's only one prescribed, we're not going to do it under the black market. So, but yeah, we want to maximize and optimize your hormones. And one of those is we do that with peptides. So we look at that. We also want to look at your immune system. That's a big part of overall growth. And then working on getting your overall sleep and circadian rhythms. So this is where we use the epitalin. And epitalin is one of those regulator hormones. So, and Kate, you've done a cycle already this year, so we're going to get you on one more cycle. So how's that look for a treatment program for you? So that's it gives you kind of a construct for the next 12 months. We're going to be taking you through and getting these 3 pathways open. We'll remove inflammation, repair the damage, regenerate and remodel. And then we'll put all the treatments in that you need. So there's no concern if you can't get, one of the allografts that we've typically deployed for you, kid. Well, we've got so many other options. So no need to fear.
Love that. Well, hey, we had a question come in, or question and a comment. I'll start with the most recent one, but Ruth was wondering what kind of ozone treatments we do.
All kinds. I mean, we do ozone in the joints, ozone for the connective tissue. We do insufflation, rectal and vaginal. We do ozone in the ears, which feels kind of weird.
Really good.
Yeah.
Great treatments with ozone. And then This is going back to kind of our earlier conversation. I missed this one. Did you see FDA now? NAC is going to be prescription only.
Yep. I
Um,
saw that. N-acetylcysteine, yeah, which is a precursor to glutathione.
prevention.
Yeah, yeah, it's 3 amino acids that don't exist typically in nature, and so the FDA is kind of looking at it and saying, well, I think this may hit the classification of a drug. So yeah, in certain countries, like, I mean, I think, let's give the FDA some credit because they are looking at things that fall kind of outside of those normal parameters. We've used NAC forever. Yeah, and it's a supplement we've been able to buy over the counter, and so yeah, I think they're just trying to kind of make sure that they're doing everything they can to keep us safe. Yeah, but they make some decisions that we don't like. But if you go to Europe, you go to the UK, holy smokes, what you're going to see is the ability to get supplements, even to get them over the counter, is like impossible. So we still have an enormous amount of freedom in America. And the beautiful thing about America is we live in the land of innovation. And so innovators, we will come up with better solutions no matter what restrictions come in. And so today I've asked one of the most amazing innovators in our field in the regenerative medicine is Dr. Buzz Korth. And so he was kind enough to come. We had a last minute cancellation, and I said, Buzz, can you join us on the meeting? Because he, with all the new things going on with the FDA, I thought he could be great to talk about some of the criteria, what it means, and then he's also got his own lab. So Dr. Buzz, welcome to Your Healthy Self.
My camera's not working. I'm sorry about that. I gotta try to figure this out. But you can hear me, right?
We can hear you loud and clear, and I'll just
see you then anyway, right?
we wish we could see your face, but yeah, but just to give Dr. Buzz, just so you guys know who he is, he's the founder of Buckeye Physical Medicine and Rehabilitation and Optimum Anti-Aging and Aesthetics. His facility specializes in non-narcotic pain relief and anti-aging therapies with bioidentical hormones, peptide therapies, birth tissue allografts, and medical weight loss. They're one of the country's most experienced regenerative medicine practices with over 10,000 procedures. This progressive approach of healthcare allowed Buckeye Physical Medicine and Rehab to grow to 14 locations. So he's a true entrepreneur. He's board certified in anti-aging medicine. He's also earned 2 fellowships, one in stem cells, one in functional medicine, both with the Metabolic Medical Institute. He's CEO of Comprehensive Biologics and frequently talks on the benefits of biological allografts on podcasts and conferences throughout the country. Buzz and I have been in the same circles for a lot of years, and we're finally collaborating in a big way. So, Dr. Buzz, good to have you here.
Yeah, I love what you're doing, man. I was listening into some of the guidance you were giving there, and I love what you guys are doing. You're really, attacking things from multiple angles. There's no magic bullet, just peptides, just hormones, just chiropractic, just acupuncture. When you mix all that stuff together, they work so well, right? And not many people mix them well like that. So, hats off to you and your group.
Yeah, I appreciate that. Yeah, there's a nice art that goes along in the medicine, just similar to what you've been doing. And so, Dr. Buzz, what was you're in the biologic world, and you have some amazing products. What was your take after last night's meeting with Dr. Marks?
Yeah, I mean, I think it's more the same what they've been talking about the whole time. I mean, they don't, obviously amniotic fluid, the amniotic membrane injectable, they don't like, and then he made that clear last night. It sounds like the whole Q code thing is going to be problematic. And even our product, we have an umbilical cord tissue product. It's not wart jelly, it's not epithelium. It's a cross section of the cord. That product is going to be fine, but if the product's just wart jelly or just epithelium, they're going to consider it more than minimum manipulation. So they're really looking at this, and they want full tissue products or tissue transplants. And I think really people need to start looking at this as you're doing a tissue transplant in your office. It's not a stem cell procedure. You're not allowed to take one portion of anything, whether it's the amniotic membrane or the umbilical cord, and just use one part of it. If you can't use the whole thing and use it homologously, they're not going to let you use it. And it doesn't matter that it helps or doesn't help, right?
Right.
And I think that people have to understand that. He's not saying these other things don't work, but they're not going to let you do it. And they're going to go after the manufacturers, they're going to go after the providers, and the other thing they're hard on is making these claims. If you're advertising or using any of these products to treat any type of condition, it's going to be problematic. So,
Yeah.
your guys need to look at their webpage, and if you put, come to our office, stem cell treatment to treat arthritis and treat this and treat that, that's the easiest thing in the world to get busted for, and that's what they're going to do. So you can say it may help. You can say we're using an umbilical tissue to contain stem cells. It also contains lots of other amazing things. But they're going to hammer down on this stuff. And then I also think he was pretty clear last night that they don't like exosomes.
Right. That was surprising because, exosomes have a very safe track record. And once again, they're not necessary. They're looking at safety and efficacy, but man, there's, the exosomes are out, and maybe you could explain the difference between a 351 and 361 and why exosomes were given the boot.
Yeah. So I think it's important for people to understand. So a 361 is a human cellular tissue product. So it's a tissue transplant, right? That's what it is. So an exosome is a secretion, just like insulin's a secretion, just like testosterone's a secretion. Then all secretions are classified as drugs. Interestingly, Wharton's jelly is also a secretion. So if you're using a Wharton's jelly product, it's considered a secretion, it's considered a drug.
Yeah.
There's no unclassified. So I've heard some people say, well, it's really not classified. Well, if it's not classified, it's a drug. There's no gray area. And they're taking a very literal stance. You're either doing a tissue transplant or you're using a drug.
Yeah. Yeah, and it's this is where the amniotic fluid, once again, that falls into a drug category, not a tissue. And so even if
homologous use, they're going to hammer too. You heard that last night. So amniotic membrane is fine to use as a barrier, right? So the amniotic membrane for patches to heal like a diabetic wound or some type of wound is going to be fine. But what they're saying is if you take it and chop it up and make it into an injectable, how is that injectable going to function as a barrier? It can't, so it's no longer homologous. So it doesn't matter that it helps. So once again, I'm not here to debate exosomes work or don't work, amniotic membrane works or doesn't work. They don't really care about that, right? If it's not homologous, they're not going to approve it.
Right, exactly. And Buzz, when we were together in Florida, you showed that video of your son. I mean, you look at the effectiveness of what you're doing, and that was impressive. So many of you don't know, but Dr. Buzz is super. How tall are you? You look just like a Viking that just stepped off a warrior ship.
I don't know about that, but no, but yeah, I had an experience recently, and I wish you'd seen me. I put the video in here. I can't have technical difficulties, but it was one of those things. We were skiing in Montana 6 weeks ago, actually last weekend, and my son had a skiing accident and fractured bilateral compound tib fib fractures. The skis didn't release is what happened. So it's one of those times you're in the hospital, and that's where you really, Regan, we all go there at some point. We have to practice what we preach.
Yep.
Really started to question, man, oh my God, this is really bad. And there was one point they were talking about he could potentially lose one of his feet. And I'm like, oh my God, what am I going to do for this kid? But you got to stick to what we know works. I literally embezzled peptides into the hospital. I got caught one day and they took them off of me. So vitamins, took my I went in with vitamin C and I had some calcium. I bought it at the local store. I didn't have anything with me. They took that off me too. That's how anti anything healthy they are, right? But anyways, we started peptide and vitamins right away. As soon as I got back to Columbus, we were able to use, we did some of the allograft injections around the fractures, into the joints. And we were told he was hospitalized for 10 days. And we were told he wouldn't be out of a wheelchair for 8 weeks. And last weekend, he raced in a national go-kart race and finished second place. And he's walking, without a cane or a crutch or anything at this point. So that's at 6 weeks. So
that's awesome.
Works for sure. And that's why I'm so passionate about it, but we also have to do it in a compliant fashion. If we want to keep practicing and helping people, we can't have the FDA or FTC shutting us down. So it's that tightrope we have to walk. We have to, help our patients. That's why we're all here. We have that purpose. but we got to be smart about it too, and follow the rules, or otherwise we can't do any good when we're in jail.
Yeah, exactly. Yeah. Yeah, and so this is, you know, it's a unique opportunity that we have, and you know, you're just an amazing healthcare entrepreneur doing big things. And at Comprehensive Biologics, one of your businesses where you do make these tissue allografts, how are you guys staying compliant on the 361 product? Because I know, you know, you're not planning on getting an IND as far as I'm aware, but what are some of the things you guys are doing to get that stamp of 361 approval?
Yeah, and you can't get an IND. So if you take your product and you submit for an IND, that stands for a new investigational new drug. So basically, at that point, you're admitting you're a 351. So if you're involved in an IND, you can only do clinical trials, and those are not for profit.
Yeah.
So as a provider, there's no monitoring. Not that it's not a good thing, but you have to enroll every patient into the clinical trial, and that has to be for nonprofit.
Yep.
So from a business standpoint, that doesn't make a lot of sense, and it also means that that product's probably not going to be available for the public for 10 years from now, because you got to go through all three phases of clinical trial. And unlike the vaccine that we just got pushed through in less than a year, typical drug pathway is 10 to 15 years.
Yeah.
So and if we want our patients to get these type of things now, that's not a really good that's not a good viable option, if that makes sense. So what we've done, what's unique about our product is it's tissue pieces. We don't take the cells and strip them out of the tissue. It's literally a cross section of the umbilical cord that is cut up and is an injectable form. And it will go through a 27 gauge needle, but you can't IV our product because it's tissue particles.
Mm-hmm.
So that's the downside to it. So if someone wants to IV it, you'd have to filter it or something. But in its current form, you could do it, right?
Yeah.
You can only use it for cushioning, structural support, and viscosity, the same purpose as the cord.
Yeah, because
Wharton's jelly, there is epithelium in it. You're getting everything in the cord minus the blood.
okay, and I think that's a unique thing, because I guess that's what keeps you at a 361, because part of the function of the umbilical cord is to protect the baby from the mother, so the baby has some space. It's almost like a suspension. Is that correct?
Yeah, well, the purpose of the cord defined by them is for cushioning and structural support of the umbilical artery and vein. So that's the purpose of the umbilical cord itself. And as I said, there's epithelium and Wharton's jelly. It's not just the Wharton's jelly, and it's not just the epithelium. The plus side to that is you're going to get, that epithelium we know is very analgesic. That's why amniotic membrane works. It works as a very good anti-inflammatory. But you also get the Wharton's jelly that we know has lots of not only mesenchymal stem cells, but there's a lot of epithelial cells. There's lots of good stuff in there. Over 3,000 different growth factors, structural proteins. You get the lattice work. You're getting both in the same product.
Yeah. Yeah, and I've seen so many companies over the years, they've started to extract, they have Wharton's jelly only, or they have the amniosomes only product, or the exosomes only. And so, we've always stayed pretty true to, just let's not just isolate one part of this beautiful process. And you're doing the same. I love, how did you come up with the particular measurements? Because last night I was impressed by your question to Dr. Marks with the FDA about the exact size of the particles. Is that your genius, or is it, I know you have,
we have a lead scientist who's been in this space. Two of my partners, my one partner has been in the space for over 20 years, and the other scientist is over 10 years. So they have lots of experience, and I'm more the entrepreneur. And more getting it into patients and combining with peptides and other stuff to make it very effective. So, it's definitely more their brainchild than mine. But, the FDA is going to want, they want consistency. So, the particle sizes we use have an upper and a lower limit. It's not just a hodgepodge or willy-nilly. They're going to want specifics. This is the particle size, it's the upper limit, this is lower limit, and it's a tissue transplant. That's what's going to help the product survive.
And do you have any reservations of continuing to administer your treatment in your clinics, administering your biologics from Comprehensive, with the new kind of the June 1st line in the sand? Or no more, they're going to kind of crack down on non-compliant 361 manufacturers?
No, I think the other thing I heard last night that I liked, and I thought Peter Marks did a really good job. They're going to crack down on the provide. They're going to crack down not on the providers, but on the manufacturers who are just getting rid of the bad things. I think the analogy he used, which I thought was pretty funny, he is, we're not going to go after the guy smoking the joint on the street corner. We're going to go after the guy that has that's dealing the fentanyl or the drug dealer or the manufacturer. So we're going to go after the manufacturers who are doing the wrong thing. And I think that's a better approach. So often we've seen in our profession that the doctors take the fall and manufacturers get off.
Right.
I like this approach they're going to do, and they're going to go after the bad manufacturers, the single cell preps, the exosomes, the other things that are clearly more than minimally manipulated. The manufacturers know this. They're going to shut those guys down first.
Yeah, and it was, I also liked how when Peter Mark's dog started to bark, he said that his dog is part of the compliance team. So better watch out for that dog.
But I will warn your providers on here who are going to be listening. The easiest way to get in trouble is your advertising and your claims. And I've seen people that have gotten in trouble not only with the FDA but the FTC. Now the FTC is no joke. You think the FDA is bad? The FTC is twice as bad. That's a Federal Trade Commission.
Yep.
If you're advertising and you're treating systemic conditions, diabetes with allografts, we're talking about here, or with stem cells, even worse if you say stem cells. Hey, I'm treating diabetes with stem cells, Parkinson's with stem cells, ALS with stem cells, COVID with stem cells. You are going to get hammered. And I've seen fines in the millions of dollars. Like we're talking about, you're out of business, you're not helping people anymore.
Right, bankrupt.
And you have to keep in mind is your website and what you put in print on the website never goes away. So, everyone listening needs to look at your website. If you have stem cell therapy anywhere in your site, take it down immediately. If you have on your site, you're treating conditions with these allografts, take it down immediately. Because that's the easiest way to bust you out.
Yeah. And I think, that we do have a certain amount of providers on here. And then we also have patients on this particular show who, they're kind of at that confused state, as far as the layperson goes. It's like, well, what do we make of all this? And so what advice would you give to our listeners who are not physicians on how to sort through all the confusing regulations that are going on?
Listen, what you guys are doing, and I think your group is pretty unique. There's not a lot of people out there doing it, is you are offering regenerative medicine services. What is regenerative medicine? Well, regenerative medicine is not a magic bullet. It's a combination of things. It's your diet, it's peptides, it's acupuncture, it's chiropractic, it's these allografts. It's getting your body to heal itself, not taking a medication to mask it, okay? So you're okay. You guys are performing regenerative medicine, okay? And I think that, as long as someone doesn't, but no matter what you do, Regan, you can't promise anything. You're not God, I'm not God, but we do the best we can to help people out. And I think, people listening to this, if you're a patient, just know that, I work literally, we have over 1,000 customers. The majority aren't doing what you guys are doing. And the little bit I listened in on here, like you're in good hands if you're going to one of these providers that's taking a multi-pronged approach. I always be a little bit nervous. If someone has one magic bullet, I'm going to cure you just with acupuncture. I'm going to cure you just with a chiropractic adjustment. I'm going to cure you just with take this vitamin. There is no magic bullet out there. A multi-pronged approach is what works. And if you're a provider, I know we're all passionate about what we do and want to help people, but you can't promise anything.
Yeah.
You're going to do your best. None of us are God. So we'll do our best. And you tell your patients, will you do your best? Make sure they have realistic expectations. One of the first things I always ask my patients, before I start the consultation is, hey, Regan, if I accept you as a patient, what would be an acceptable outcome? What would make you happy with being a patient here? And if you have an 85-year-old person that wants to do triathlon, that's probably not realistic, right? But if it's to, play with my granddaughter and get off my medications, that's realistic. I'll work with you, right? Just have these realistic expectations and make sure, because anyone I've seen who's gotten in trouble, I've had multiple doctors that treat people, and I look at the exams, and they went from a level 10 pain to a level 3 pain, which is a miracle. They're supposed to have surgery, but they're unhappy, and they'll turn them into the board.
Right.
But you were supposed to have knee replacement surgery. So realistic expectations. The space isn't going to go away, right? But I think that they're going to tighten things up, and they're going to get rid of the bad actors and the products that just don't follow the rules they're laying down for us. It just is what it is.
Yeah. Well, and I think this is just such an amazing time to be alive because we need to innovate. We need people like you. I really appreciate everyone on the show who's done these services. You've gone through treatment programs with us. I mean, Buzz, I know we have very similar philosophies in medicine, but we like to work with patients for a year minimum. And that gives us the runway to really solve the complex problems. You know, if someone's telling you they can fix you in 30 days, you ought to be skeptical.
No, yeah, you can't. Most people, the reality is when people have health conditions, it's kind of like when you have a cavity, it's not because you had cake the night before. It's the cake and donuts and whatever the best that you've had over years.
Right.
So it takes time to fix that stuff, right? If you're out of shape, you're not going to go to the gym for a week and get in shape, right? It just takes time. But enjoy the journey, man. The journey's fun.
Oh, it's so fun. And so just as we kind of close up, what are some of the things you do personally to keep yourself fit? I know you do peptides but what are some of your biohacks?
I'm a huge believer in intermittent fasting.
Yep.
I fast 16 hours at least 3 days a week. I think that's the easiest form of dieting. So if anyone hasn't tried it, that's a big one. I think everyone should do peptides. They're amazing. They're very safe profiles. They're just a change of amino acids, and I think that a good GH booster like a Smorlin or CJC or BPC 157 is another 157 is another amazing. There's no reason not to take those. And obviously, I try to eat healthy. You are what you eat, right? So if you're eating a bunch of junk, you're not going to feel good. So fruits, vegetables, lean proteins, just the basics. And everyone knows this stuff, but sometimes you just need reaffirmation.
Yeah. What do you do for exercise? I mean, you obviously lift weights. What else? And you're very active athletically, but what else do you do?
I do basically just work out with weights. I do Muay Thai a couple days a week. And I have two young boys, so kind of whatever the hell they want, they're 14 and 17, so whatever.
Yeah, you got to meet my boys in Florida, and so yeah, and
the Nelk boys too.
Yeah, exactly. Yeah, that was pretty cool.
My sons were so mad at me. I got to tell you, when I got home, I guess the Nelk boys are like a huge deal. And I actually rode on the elevator with them down. And he's like, "Dad, you get a picture?" I was like, "No, I didn't think it." Oh, they freaked out on me. So I got in big trouble over that.
Yeah, my boys can't quit talking about it, and I didn't even know who they were. So, but yeah, they are funny. They do some funny things on YouTube.
Yeah, watch those videos, guys. Nelk boys, it is funny stuff. It's stupid fun.
Yeah, it was great. Well, Dr. Korth, it's been awesome having you on. We're going to have you on again. I really appreciate you coming on last minute. I think
I appreciate being on here. The way you guys are treating people is exactly what we do. I really believe in it, and I wish we had more docs like you guys.
I really appreciate that, and appreciate the friendship and collaboration. And we'll be in touch soon. You enjoy the rest of your day. And Kate, any final announcements we've got as we close up?
No, really appreciate you being on, Dr. Buzz. We'll be back same time, same place next week, everybody. Have an amazing week. And don't forget about your hack challenge. Exercise every day. Get it done.
Every day.
See you guys.